bigger issues I see from colleagues are around sometimes long working hours, not finishing on time, not having protected study time like doctors do, or trying to get the right skill mix in your working environment so that patient workload is manageable.
The first RCN nurses strike for 106 years is underway this morning. It's going to start at 8 o'clock. We'll be hearing throughout the programme from nurses on the picket line, from patients with cancelled appointments and from NHS England. First, we're going to speak to Maria Caulfield. Now, she is a health minister and also a former nurse. Good morning to you, Maria.
Good morning.
I think I'm right in saying that you went back to work as a nurse during the pandemic. Is that right?
That's right. And I still do shifts at my old hospital as well.
So clearly you're still in touch with nurses. What do they say to you about pay and conditions and why many of them, most of them, are going out on strike?
Well, it is with regret that 44 of the 215 trusts in England are going out on strike today, and the Welsh Government are facing all but one of their trusts, and Northern Ireland are facing all of their trusts. So it is with regret, and pay is an issue. When I was working full time, I went through the pay freeze and the pay cap, which were very difficult. That was under when we had the Lib Dem coalition government, and they were difficult times. But it is the bigger issues I see from colleagues are around sometimes long working hours, not finishing on time, not having protected study time like doctors do, or trying to get the right skill mix in your working environment so that patient workload is manageable. So pay is an issue, but it's almost a smaller issue compared to some of those others, and that's why Steve Barclay, when he met with the RCN earlier this week, wanted to talk about those very issues as well.
But he didn't want to reopen pay negotiations, and that's why the talks failed.
Yeah, so we have been pretty clear. There is an independent pay review mechanism in place, which looks at a range of factors from inflation to staffing levels to retention and recruitment issues, and they come to a decision around the pay offer. And pay is important. That's why nurses were given 3% last year when no one else was. It's why the government accepted the pay review body's recommendations of 4.8% for the average nurses, but even above 9% for those on the lower bands, because we did recognise that. But the unions are involved in that process too. So it's and that was accepted for the April pay rise this year.
Are nurses not a special case, though? Because if you think back to the pandemic, which you worked in, they were literally next to people who had a very infectious condition, and many of them died. For them now to be told that you can't have anything extra, and I understand you're talking about the 3% pay offer. They're asking for a lot more than that. They say they've had a real terms pay cut over the last decade of 7%. We know what inflation is currently running at. Don't they deserve something extra?
Well, yeah, of course, nurses went above and beyond during the pandemic, and my 25 years of nursing, they were the most difficult times, quite frankly, that I ever worked in. But there were also other groups of professionals and support staff as well. There were porters, there were cleaners, there were doctors, ambulance workers. Lots of people put themselves at risk during the pandemic to help out. And the two real big factors for us in terms of why we can't accept a 19% pay increase, firstly, is at a time in high inflation, we know that inflation busting pay rises will just drive inflation further. And we're just seeing the green shoots of recovery with the figures yesterday that inflation may be on its way down. It's the biggest enemy for every household in this country, and to kind of agree inflation busting pay rises for nurses would inevitably lead to pay rises like that being asked across the sector, public sector. But also it's how we pay for it. We only have three routes to pay for this pay rise. It's either to borrow more money as a government, which we saw the results of what happens when you do that just a few weeks ago, if you can't afford to do that. Secondly, to tax the taxpayers more, which I don't think is acceptable at a time of a cost of living pressures for everyone. or we take it out of healthcare budgets, meaning we
Okay.
have less money for frontline staff. So they're the difficult
Of
choices we
course.
have as a government.
But another difficult choice, of course, is that if you don't pay these nurses more and make the conditions better, then not only will people not want to do the job, a lot of the nurses will leave. And there's already a shortage of 47,000 NHS nurses in England. So it's never
Yeah,
going
no,
it's never going to improve, is it, if you don't make it an attractive job?
well, absolutely. But that is why we gave a 3% pay rise last year when no other sector in the public sector got a pay rise, to recognise absolutely the efforts that nurses went to. It's why we did recognise or accept in full the pay review body's recommendation for
Yeah.
4.8%,
Yeah, of
and
course.
over 9 for
Yeah.
the lower band
But
of
you're not bound by that. That's a recommendation, and it's probably quite out of date, isn't it? If you think about what has gone on since then.
We're not bound by it, but as I explained, we have to justify to the British public how we pay for it. There is still a pay gap of around 7% between the private sector workers and the public sector workers, and it's those people that are often on lower wages than the nurses that will have to pay for it. If we went to an inflation level pay rise across the public sector, that would cost most households around £1,000 extra a year, and we have to be able to justify that to the public. And if what we did is give those sorts of levels of pay rises across the public sector and inflation starts to go up further or doesn't start to come down, that impacts on each and every one of us, and it puts pressures on government budgets as well. So there aren't easy solutions to this. And as I said, the Secretary of State was very happy to talk about all the other issues that make life difficult for nurses across the board. But the RCN, certainly want to stick to the 19%
Okay.
request at the moment.
Right. Well, at the moment, but these things may change, and then obviously the cost per household would go down. And people who got in touch with this program, some have said that they would be willing to pay that, and some obviously wouldn't. I just want to ask you about one other medical issue. Maria Caulfield, you said in Parliament recently about problems getting antibiotics for strep A.
There is no shortage of antibiotics. We want to reassure people on that, and we're keeping an eye on that on a daily basis.
Is it fair to say there is no shortage? Because it doesn't really match what people are telling us. Lots of other journalists, GPs and pharmacists tell us that there are shortages. Our colleague on this radio station with a sick child tried 20 pharmacies to get Pen V yesterday and couldn't get any. So to say that there are no shortages doesn't seem correct.
So what we, from a national point of view, from a manufacturing point of view, we have stock that's available. But the sheer scale of demand that we've seen over the last few weeks, there's been a 40% increase in the number of parents taking their children to GP surgeries or to A&E and, getting prescriptions. And as soon as supplies arrive at local pharmacies, they're out of stock very quickly. So we have upped deliveries to pharmacies where wholesalers are trying to get as much supply out there as possible. But it is hard to keep up with that demand. But nationally, there isn't a shortage of those antibiotics. And we're also putting in extra measures, which we call SSPs, which will give pharmacies more freedom to be able to dispense the same medication, but sometimes in different doses or different preparations.
Right.
So we can make it as flexible as possible for pharmacists to be able to dispense the stock that they do have.
Okay, Maria Caulfield, thank you. She's a health minister and also a former nurse.